Minister of Health and Wellness. Hi, welcome.
How are you?
I'm very well, and you?
I'm fine, thank you very much.
Very good. Okay, so you're on the pulse with me. What we're talking about
very
today?
Low. Turn it off for me.
All right, let's
But
see
I
if we
think
can.
we have two devices up. You're back up on the computer now. Should I come off the phone?
You can if we're low. No, before you just mute the phone and talk through the computer. Let me see if I can hear you through the computer before you hang up off the phone. All right, try through the Zoom. Hello? I'm not hearing you at all on Zoom.
Are you hearing me now?
I'm hearing you now. Thank you. So hang up the phone. Thanks.
Okay. All right. Hi, Emily. Long time. Seems like you had an extended Christmas, New Year break.
Oh, don't I wish that was the case? Working.
Well, work is good. Keeps you engaged and active.
Yes.
So I'm happy to be here today. I'm here with Ms. Dion Bent, manager of Dietetics Services, and she will comment on some of the things that we're doing, including yesterday where I was at the Percy Junior Hospital where we had the 12th baby-friendly designation, which really means catering to mother and child in a friendly way by putting infrastructure in place for breastfeeding, privacy, guidance to staff that will give to mother and child, basically promoting responsible parenting and healthy parenting. And Miss Ben can comment on that. Yes, the day before that, we had the National Health Research Conference launch, which is a 3-day event at the Pegasus, where we awarded a few wellness grants for research in health, focusing primarily on lifestyle-related illnesses. It's an annual event. This was the 16th one, but the first one where we actually are giving grants based on competitive tendering for that money to do research that will go back into supporting policy, which we think is very important. So those were the things this week. Tomorrow I'm in Montego Bay where we'll meet with the donors of the Dome, which is a 100-bed facility that we will begin to install at Cornwall Regional Hospital. That will relieve, I think, the challenges of beds. And I'll be there tomorrow with the team, NHF, and also look at some of the work that's going on there. So that's happening, and we're happy to be on the program as usual.
Okay. Tell me a little bit more about the National Health Research Conference and this thing where winners will be announced. What do people need to do, or what have they done to qualify for this competition that is ongoing and where winners will be announced?
Right. The volume is very low and it has a humming sound, but I think I heard you.
Yeah.
The research conference is geared towards bringing researchers from all over the world, actually, not just places like the University of West Indies, UTech, internally, some of our own internal persons, organized by the epidemiology unit of the Webster Carr, which is the unit that collects all the data in health and guides our positioning and what our results.
Yes.
And essentially, it brings researchers to look at the research that is being done in health and hopefully learn lessons from this work, these works, and then filter some of that back into policy. Now, we have taken a decision, we took a decision a few years ago, that we were going to be more proactive by promulgating research topics, research challenges based on the challenges we have on the ground in the health field. So take mental health, for example. It's a big area, it's growing, and how we engage the mental health challenge at the community level is a big thing. I mean, it involves all of the community. It involves sensitization, stigma, breaking down the stigma, and so on. Take nutrition, for example. There is a big issue around nutrition in schools where we need our youngsters and the school administrators to establish an environment where food that is nutritious and balanced is more accepting to our youngsters, because they're tempted every day by the marketing campaigns and some of the other things that they're exposed to. And so we push these topics and we assess the research proposals. There's a committee that does that. And then a grant is awarded, 50 million a year, support the research. And then the proceedings of that research work is then presented and filters back into supporting some of the policy issues. So it's important because we have to allow policy to be driven by data. I'm big on that because of my university background. And I try to promulgate that as much as possible in health.
Okay. All right. Let me come over now just to find out some more from Ms. Dion Bent, Manager, Dietetic Services. Remind us what that is.
Yeah, you can speak, but we're going to have to go back to the phone.
Okay. You've disconnected from the phone? Ms. Bent, should we call you back on the phone? Ms. Bent?
Good morning, Emily.
Morning. Remind me what dietetics is, please.
Okay, thank you so much. Dietetics is concerned with the management of diet and diet-related conditions, in particular in relation to hospitals, as it relates to my role. So you have who have achieved certification in food and nutrition, and they're able to manage the nutritional care of patients in a hospital setting.
Okay. Okay, so that means the breakfast that is served, somebody has signed off on it that it is a balanced meal?
Definitely, there are meal standards that are developed, and then those standards are translated into nutritious and appealing meals, because we want, patients are ill, but we want them to eat what is provided.
Okay. Okay. All right. So based on that now, anything you want to tell me, anything else you want to tell me about the matters we're discussing today, the Percy Junior Baby Friendly Certified Hospital or national?
Yes, definitely. Yesterday was a win-win for the health system in terms of our healthcare workers, pregnant women, mothers, and newborn, because Percy Junior has now added the pool of certified hospitals to 12. And there are another 11 that are preparing for certification. So women of childbearing age in Jamaica, we want them to know that wherever they are, they can access care that is of a high quality. And the quality we're referring to is the World Health Organization global standards. And it is independent assessment. It is intense, and it is concerned with monitoring. So it's more than just paper compliance. You know, these hospitals have to put in the work, and we saw it yesterday from a committed team, from administration all the way down to the non-clinical staff in the facility, and we commend them.
Yes. All right, let's take a break. When we come back, we'll hear some more, and we'll also take your calls. We know you always have a lot of questions for Dr. Tufton in this segment. 87692. Dr. Chris Tufton, Minister of Health and Wellness, remains with us. So too Ms. Dion Bent. She is Manager Dietetic Service in the Ministry of Health and Wellness. Dr. Tufton, I have a question. A lady actually came to see me, and she sent me a little letter here. So it's so important to her. She needs help. She had a son who was admitted to one of the hospitals, and the son died in hospital 2 years now. And the son having died, the hospital has been calling her to settle a bill, which is over $500,000. She doesn't even have the first cent. And it is weighing on her mind, and she's wondering if there's anything that can be done through your ministry to help to sort of settle that bill with it's a UHWI. I know it's a sort of public-private facility, but anything?
Well, we have the Compassionate Fund, which is online on the Ministry of Health's website, where persons apply when they have issues. We do support a lot of it, of procedures at UA also. So she could go online and apply. Ideally, she should have applied prior to incurring the bill. But if they have allowed her to do it, maybe it was an emergency, then she can make a case there. So
Right.
she can start with that. If she leaves her name and number, I can have my team guide her through.
Yes, it's a letter. So we'll send her the details because she really wrote us a letter. She came yesterday, but she wrote a letter. So we'll pass it on to you. Thank you for that. 876-926 7615-926-8631. And if you have any questions at all on the WhatsApp line, then you can send them since we're trying to make sure the phone lines work well. Okay. I live 3 miles from Percy Junior Hospital in Spalding in Clarendon. I was made aware that should I become sick, I will only be afforded emergency care, but thereafter I have to go to a hospital in the parish of Clarendon. Recently, 3 persons from my district of Sanguinetti had broken limbs and they were directed to Maypen Hospital. So that is, but what's the question?
Where is that calling from again? Sorry.
Clarendon. The person lives in Sanguinetti, and they say 3 miles from Percy Junior, but they were told should they become sick, they will only be afforded emergency care.
We would have told them that though, because Percy Junior is a functional and quite efficient hospital.
Oh.
That certainly can't do everything because they're not designed for that.
Yes.
But can do enough if someone is sick for them to be managed, stabilized, triaged, and if necessary, transferred if that is necessary. So I'm not sure. I was up there yesterday and there are doctors and nurses there a lot.
So it's not only emergency cases they're doing at Percy Junior then. So they're not doing only emergency cases at Percy Junior? Dr. Tufton?
Someone has gone again.
All right. I'm so sorry about that. Let's just see. Can you hear me now? Can you hear me now? Dr. Tufton? We're trying to rectify.
I'm barely hearing you. The sound went out again. I don't know if you're hearing me.
I'm hearing you, but you can't hear me. Hold on, we're trying to rectify that.
I have to use the phone again. The system is not functional.
All right, just hold on for me.
I'm hearing you now. Hearing you now, low.
All right, all right, thank you. I'm so sorry about that. Apologies, Minister. Apologies, listeners. I was asking, so you're saying Percy Junior is not only accepting emergency cases?
Right. Percy Junior does several things. They do surgeries. They do a lot of things. I was there yesterday, and they have a full team with an SMO, CEO, and others. So I'm not sure who gave her that information, but I don't think it's accurate. I know it's not accurate. Sorry.
Okay. All right. Somebody's asking if you can please verify whether prescriptions written by a private doctor is to be accepted at drug-serve pharmacies. And that is because a friend took a prescription for a particular ailment and was told she had to take it to the private pharmacy because it was written by a private doctor.
Right. So the drug-serve pharmacies serve the public health system. They don't serve private doctors. If we did that, then private pharmacies would be out of business, but also we couldn't afford it. So if you want to benefit from the free drugs, you have to go to a health center or a hospital under the public system. If you want to benefit from NHF discounts, then you get an NHF card, which is very easy to get. And based on your illness, you can get a discount at any pharmacy. Well, certainly the private pharmacies. So there are options for you, but if you want a straight free drugs, then you have to go via the public health system.
Okay. All right. We're trying to see who else has a question on the WhatsApp line, 876-553-5908. We're getting interference when we have the callers join whilst you're on the line, which is why we're not taking any direct voice questions from listeners. Okay, so let's see who else is there. 876-553-5908. And then the compassionate grant, Minister, if one qualifies for the compassionate grant, is there a monetary limit?
Yeah, the grant, goes up to, I think it's $1 million. If it has to go beyond that, it has to have the intervention of the special considerations that could mean going as far as cabinet. I mean, we've had people who have benefited from more than that, but it would require high levels of approval. So her case, she says 500,000. She would certainly qualify once the committee gives it consideration. They may not give everything sometimes because it's a lot of demands, but they would certainly try to accommodate depending on the circumstances.
Right. Somebody says they live in Boroughbridge, St. Anne, less than half an hour from Mandeville, but if sick with a fractured limb, they have to go to St. Anne's Bay. Is that so, and why, if so?
I didn't get that. They live in where? Sorry?
In Boroughbridge,
right?
Which is close to Mandeville.
Boroughbridge is up in the hills. Yeah, I know where it is.
Right. But if they have a fractured limb, they have to go to St. Anne's Bay.
No. Well, look at it this way. It's hard to comment on specific cases.
Yes.
What would happen, the public health system is a hub and spoke system. In other words, you don't have specialized areas in every hospital. It works on a system of referrals. But every hospital is a point at which someone can go and doctors can examine them, and a nurse, they can stabilize them. If they require specialist care because of the nature of the illness or the injury, then the doctor will contact the doctor at the hospital closest with that specialization, and based on a doctor-to-doctor arrangement, they are transferred to the next facility. So you know certain things that very few other hospitals do. Cornwall Regional and KPH, similarly so. So people end up at those institutions from all over the country. The same for Bustamante Hospital for children, because we can't provide all the services in every institution. That's why we rank the hospitals A, B, C, or 1, 2, 3.
Right. Somebody's asking, how can one get an NHF card?
Very, very easy. It takes 15 minutes. You go to the NHF office in New Kingston. I'm not sure. I think you can fill up a card at any drugstore window. They'll give you some of the application. But if you go to the NHF office in New Kingston, they fill it out. You can literally wait for it. It's very efficient.
Right. Also, what's the criteria for the compassionate grant and who can get it?
Any Jamaican, except that it is based on a needs assessment. So if you are able to afford based on that means test that the committee applies, they will likely say no. And they give certain types of treatments, not everything. There's a policy that guides it, and there's a committee chaired by a doctor, a retired doctor, and has several other representatives on it. And they go through the list on a weekly basis and make a determination. So anyone can apply, but it's really a function of ability to afford or inability to afford, and the areas that it covers.
Right. I'm seeing somebody saying the C-arm machine in operating theater in Spanish Town Hospital is dysfunctional. It has been so for months. You know,
I'm not sure. Last week, that issue came up last week, and I spoke to the SMO there, and she told me it was working. So I'm not. It was working last week, so I'm not sure if that person, if it's the same person who is sending that spoke last week on the program.
Oh, what does a CR machine do, Minister? Do you know?
Surgery, yeah. It's one of those machines that support surgical procedures.
Right. At the moment, in the major public hospitals across Jamaica, we have all of the machines working, or what?
Absolutely not. That would be almost a miracle.
What?
These machines work a lot of hours, and there's always downtime as a matter of almost necessity, either for repairs, for fine-tuning, for cleaning. And sometimes there are issues related to waiting on spare parts, waiting on the expert to fly into the country. You will recall that I had indicated that we're moving to a leasing arrangement.
Yes.
I'm understanding that it is in its final stage of procurement, because taking
Oh
forever
my God.
to get there.
Still
Yes,
in
believe it or not, I
procurement?
tell you, procurement is a real challenge, I must tell you. In this case, there was one applicant who went to the courts over something, and it had to go to a hearing, and it's going on for almost a year, to be honest with you.
Yes, I remember you talking about this long
Yeah.
God.
Still on it, in the meantime, we have gotten new machines from digital x-rays and so on that are at places like Sav and Cornwall and mammogram and so on. But it's hard you cannot guarantee that all machines will work at the same time. What you want is most of them to be working most of the times. So we try to be institutional specific if there's a concern, as was said about Spanish Town and the CR machine.
Mm-hmm. Somebody is asking now if hot water can be installed at Princess Margaret Hospital, especially on the wards for patients to get a warm bath.
Surprising that it's not hot water. It's supposed to be available in all hospitals and health centers, every single one. So, especially if it's on a surgical ward, because infection prevention and control requires heating for whatever purpose. So I am surprised at that. I'll check on it and find out if there is a specific issue with that.
Yes, Princess Margaret, they say.
And we've spent a lot of money on that hospital, and we installed a massive storage water facility, which was commissioned recently. But I'll check on it. I'll have the team check on it.
And you have solar system in a lot of these hospitals, or not yet?
A lot of them, but we want to standardize that across the system. So any upgrades that are taking place and will take place in the future, we're going to include solar as part of that, and in a maintenance arrangement to just maintain the critical mechanical issues.
I have to do a CT scan cap. I'm a pensioner. Can I get the grant?
You can apply for sure.
Yes.
I don't know which institution they're going, but some institutions will be able to do it. I think there are a few hospitals that can actually do it. Otherwise, yes, it requires private payment.
Okay. All right. I'm out of time. Just before we go, Ms. Ben, quickly, how are we doing with breastfeeding?
We could do so much better. Yes, because we have a target for 2030 where we want 7 out of every 10 lactating women to be exclusively breastfeeding, giving their babies nothing but breast milk for the first 6 months of life. And we are not on target. So we need to be doing much more.
All right.
We are encouraging our mothers to realize that this is the best start you can give a newborn.
Thank you. We're out of time. Ms. Dion Bent, Manager Dietetics. And thank you, Minister Tufton, Health and Wellness. That's On the Pulse Headlines Time.